How you doing, everybody? I'm Ken Bykoff, and welcome to O'Neill Speaks, the official podcast of the Paul H. O'Neill School of Public and Environmental Affairs at Indiana University. The COVID-19 pandemic pulled a number of issues into the spotlight, and one of the brightest spotlights fell on healthcare supply chain issues. Most stories focused on securing enough masks for medical professionals, especially early in the pandemic, but everything from hand sanitizer to IV bags to medical tubing became an issue for the healthcare community. Now, crisis creates the opportunity for change, especially when it comes to the supply chain and the healthcare industry. With that thought in mind, the National Association of Manufacturers recently released a study titled Advancing Resilience in the U.S. Healthcare Supply Chain After the COVID-19 Pandemic: 4 Areas of Opportunity. The study outlined steps to improve healthcare supply chain resilience to allow manufacturers in the United States to better prepare for and adapt to the next disruption. The study analyzes lessons learned from the COVID-19 pandemic, during which manufacturers across the United States produced critical healthcare supplies in a highly unpredictable environment that affected every industry level. We're joined today by Associate Professor and Director of the Manufacturing Policy Initiative at Indiana University, Sameeksha Desai, who led the study. Professor Desai specializes in entrepreneurship, competitiveness, and economic development policy. In her research, she explores the conditions that influence entrepreneurship and the regional economic and resilience outcomes of various types of entrepreneurial activity. Sammy, thanks so much for joining us.
Thanks for having me, Ken.
So tell me how this project came about.
Yeah, so the National Association of Manufacturers is a large organization that represents manufacturers all over the United States. They approached us and generously supported it, and so that's how we were able to get the study done.
Supply chains, it probably wasn't something that people certainly took it for granted pre-COVID, but when you run into problems, with what we were going through, what are some of the biggest lessons that you learned through the study?
So we actually, in the study, identified 7 lessons. That was one of the goals of the study, is to come away with lessons learned. And what we found really is that everything needs to work together for it to work well. And what I mean by that is you need to have fast responses by manufacturers, right? You need to meet demand when it exists, not 6 months later. So speed really matters. We also learned that information really matters and that manufacturers have different types of access at a given time. And one of the big gaps in the sort of policy and regulatory space often is not that something doesn't exist, but that the information isn't effectively communicated or accessible to everybody. And so it's really important that good information is flowing and quickly. We also found that, of course, costs matter, but it's not only the cost of production. So manufacturers are often factoring in the costs of uncertainty. And so questions like, if I make 500 units of something and tomorrow somebody only needs 200, what happens to my company, right? So there's those types of costs. There's also policy costs. And so in a pandemic environment, like with any other environment, every product is regulated. And so getting good, clear communication on what's changing, whether or not some regulations are becoming tighter, becoming looser, those all really matter. And those are how manufacturers also perceive and feel the cost of doing business. We also found that networks matter a great deal and that there are a lot of opportunities, and we saw many during COVID, to share information, and many of these come from partnerships. So there's a great deal of connective tissue in the manufacturing industry, including associations, member-based organizations, nonprofits, support organizations, as well as groups of manufacturers themselves that play a really important role in actually creating networks and sharing information. We found that size matters, and this shouldn't be a surprise, but sometimes it feels like it really is. And that is that small and medium-sized manufacturers often face a very different landscape than large manufacturers. So their cost structures are different. They don't necessarily have the same resources. For example, large companies, not always, but often will have a federal or a government outreach office, right? And so, or a public policy office or function. And a lot of small manufacturers don't. So their ability to engage in the policy process sometimes is different from the ability of larger manufacturers. We find, of course, that technology matters, and technology not only in terms of being able to produce and innovate, but also being able to do things like offer new workforce opportunities. We also found that, technology is important. It matters a great deal, but it also brings with it some new questions. So as more and more companies, for example, became more work from home friendly, this also creates different types of needs from a cybersecurity perspective, right? And so technology is great. It's not a silver bullet. And so that was sort of an interesting, very nuanced finding. And then that flexibility matters. So solutions can come from anywhere. And certainly we saw a lot of really interesting solutions and responses during COVID to address healthcare needs from companies that had not previously worked in the healthcare supply chain, had not previously produced healthcare supplies. And in order to allow these types of solutions to flourish, we really need a flexible policy environment.
So, how did the COVID-19 experience possibly change people's views of the strengths and weaknesses of supply chains?
First of all, I think a lot of people really thought about manufacturing. And I don't know if that was the case for people who didn't deal with it every day, right? Who weren't manufacturers, who weren't regulators, who weren't in economic development or in association. So one of the things that happened is I think everyone saw that manufacturers really stepped up. They stepped up. Many manufacturers stepped in for the first time into the healthcare supply market. And they got creative, they innovated, they looked for resources, they met demand. I mean, manufacturers really they met the challenge. They took action. What I think we also should take away is that they can't do it alone. And particularly when we realize that so much of what manufacturers did was hyper-local, right? So small and medium-sized manufacturers were meeting demand 3 miles away and 10 miles away. And so that, I hope, is one of the lessons that we took away from the pandemic. The other thing is we also collectively should think more about resilience. And we didn't end up in a situation where we had critical healthcare needs in very short supply out of nowhere. And so we typically think in terms of producing something as quickly as possible, for as little as possible, and as efficiently as possible. And we also really need to think about resilience. And I think from a policy perspective, that's a real priority in healthcare supply chains, but not only in healthcare. And that we want to think about how we also can have the ability to adapt to a shock, right? Because unfortunately, the COVID-19 pandemic won't be the only one. And so I think if we really try to think about how can we maximize efficiency, have cost savings, and also have resilience, right? We can take sort of a more comprehensive big picture look at our supply chains, and I think that'll benefit all of us.
I know this study was through the lens of such a big shock to the system.
Yes.
But what kind of lessons can come out of it that maybe will make supply chains more efficient along the way, even outside of a shock kind of situation? What lessons were learned that could just help streamline things or make it more resilient, even when you aren't dealing with a major event?
I think if we can get our industry as strong as possible before the next disruption hits, we're in a much better position. And what I mean by that is, can we have a regulatory environment that is flexible and that allows firms to get good information quickly, that communicates effectively what is actually required, and that has some anticipatory practice or some anticipatory look at what could happen and how we might regulate when a disruption does hit, right? So it's always good to think forward. And so if we had frameworks in place where we knew, okay, these types of things could easily meet requirements of emergency use authorizations, or, this effort that is currently focused on something particular in the industry right now, we could pivot that, and that could be used for an emergency purpose, right? Now, it's not possible to anticipate every emergency or the source of it, right? It's not always going to be a pandemic. It might be something related to a natural disaster. It might be something related to a population shift or climate change, or, who knows what the emergency will be. But I think if we can have a regulatory environment that is flexible and that has the perspective of how to respond quickly when there is a crisis, and we have that ready 5 years ahead, 10 years ahead, and we practice and we understand here's what it will look like, and we're able then to quickly deploy what we need from a regulatory perspective, then I think we're in much better shape. Related to that, I also think part of the job that we collectively have, including our policymakers, is to enable those organizations and those efforts that come from us. And what I mean by that is some organizations played a tremendously important role during the pandemic, and these are sort of the connective tissue organizations, right? And so enabling them to empower manufacturers, to deliver information, to make it so that small and medium-sized manufacturers don't have to wonder, how do I meet this particular requirement? Or how do I know how many masks this hospital 2 miles away from me needs, right? So enabling these connective tissue organizations to really deliver information and bring manufacturers and people together is really important. And I think in particular that matters because we never know where the next solution is going to come from. One example that I'll give you is that an undergraduate student at university had a 3D printer, and she realized you could use it. And so she actually led an effort to get a number of other people with 3D printers together to produce PPE. So I don't know that we would have, if we had a lot of brain power in the room and we had to make a list of all of the potential solutions that we might come up with or we might see during the pandemic, that we would have thought of all of these really grassroots types of solutions. And that's why partnerships matter. They are really great for information sharing. They're really great to mobilize resources. And you just never know who the person is or who the manufacturer is around the corner that can get involved in the effort. The third thing I think is really that we have to think about entrepreneurship and innovation in a much more clear manner. We often think about entrepreneurship and innovation as an economic development problem. And then we think about manufacturing as a production problem. And really, they're all connected. And so when we want a strong and resilient manufacturing industry, it also means that we have to have really robust innovation. And it means that we have to have an environment where people can start businesses in manufacturing. And it's not hard to do. And if those businesses do well, they need to be able to scale and grow and hire and invest in technology. And so the final thing is really about the changing workforce in manufacturing. This is not a new problem. Manufacturers have had challenges for a very long time. And it's really not only about who is in the workforce, but it's also how to keep people in the workforce and how do people get back into the workforce. So, for example, when people move in and out between industries or somebody takes some time off from working, how do you get those people back in? And then how do you get that entry-level talent in as well? COVID really showed us that we have to think about manufacturing in a holistic way. We have to think about manufacturing companies. And certainly when we do that, we also have to think about small businesses and large businesses. But we also have to think about manufacturing workers because they are really the lifeblood of our manufacturing companies. And so thinking through how do we make workforce development accessible to people? How do we make training opportunities available? How do we make it so that people that face non-industry barriers, so things like a lack of access to childcare, things like transportation barriers, how do we think about those problems and fix those collectively at the policy level, at the regional level? Because the other question that I think we all have to ask ourselves is what happens when those burdens fall on manufacturers, right? So one thing we saw, and we're still seeing it now, is manufacturers are saying things like, we're offsetting the cost of childcare, or we're thinking about offering childcare. And those are national level problems. and not necessarily problems only facing manufacturing companies. So I think that's one of the toughest things that we're going to have to deal with, which is to really parse out what role should everyone be playing in addressing things like the childcare crisis, in addressing things like barriers to transportation. And, in the healthcare supply chain, we saw these play out quite a bit. But again, it wasn't unique just to this sector.
Is there a certain amount of time pressure as we get farther away from the heart of the COVID-19 pandemic to where you want to, if you're going to make changes, it has to be close enough to where people still remember the struggles as opposed to moving on mentally? Is there an opportunity or some time pressure where governments and policymakers can work with manufacturers to get these needed changes in now before people move on too far down the road?
Yes, absolutely. And I think you've captured exactly the challenge, which is people forget. And, I hope we don't wait until the next pandemic or the next crisis, whatever the crisis might be, to remember that resilience really matters. And that's where really the role of these connective tissue organizations is so powerful. Organizations that not just advocate for manufacturers and for the industry as a whole, but also put resources together and really sort of keep this on the agenda, right? So I think, so I'm looking forward to that. But yes, it is always a concern that after a crisis, once you recover, you forget. We go back to the old way of sort of thinking, which doesn't always include resilience in most cases,
Is there any issue that you want people to understand about this issue that we haven't spoken about yet?
We spoke about it a little bit, but I think it's really important to remind everyone that manufacturing is not about the mask or, in other cases, say the iPhone case or, the things. Manufacturing really is about people. And that was the biggest challenge during COVID, right? But we also saw the people, the manufacturers that own the companies, the shareholders, the workers, the engineers, the people doing R&D, the partners, the investors. We saw manufacturers as a whole really step up, and they did a fantastic job. And they did a fantastic job because of the people, right? The people involved. And it's the same for policymakers. I think we need to have some empathy for the tough challenge because everything is really done by people. And so we want masks, we want sterile gowns, we want vaccines, we want, syringes and needles and all the things we need in healthcare supplies. Then we need to make sure that we really center our thinking around people. And I think that's really the most important thing.
Well, supply chains and manufacturing is something that was certainly taken for granted, and it's obviously a huge portion of our lives, whether it be healthcare or everything else that we deal with on a day-to-day basis. I thank you so much for coming on to talk a little bit about the issue, and I appreciate the work that you've done with the study.
Thank you so much for having me.
Well, that's all the time we have today on O'Neill Speaks. O'Neill Speaks is the official podcast of the Paul H. O'Neill School of Public and Environmental Affairs. All opinions and comments on O'Neill Speaks belong to the host and the guest of the O'Neill School and don't necessarily reflect those of the school itself. Music for O'Neill Speaks is by Manos Mars. Be sure to subscribe to O'Neill Speaks on Apple Podcasts or on your favorite podcatcher app so you don't miss an episode. We're out of time, but for now and for the O'Neill School, I'm Ken Bykoff saying thanks for listening, everybody.